Combining the power of health workers with the power of information and communication technologies is a potent and exciting idea which can help advance universal health coverage. I congratulate the organizers of this forum for this innovative program to explore how ICT can contribute to today's health workforce education needs. Thailand's national forums, which began 4 years ago, are called reform forums. Reform does not mean only change, but it means change with a direction and destination in mind. For me, the direction and destination is clearly universal health coverage. We live in a fast-changing world which still has major inequalities. In WHO Southeast Asia region, at least 130 million people still lack access to essential health services. The Sustainable Development Goals have put renewed emphasis on leaving no one behind. In health, this has put the spotlight back on frontline health services and therefore on frontline health workers, those working in communities and primary level health facilities. The need to scale up the education of these health professionals is just as important as the education of hospital health workers. Today, our health workers also have to adapt throughout their careers. They have to continually update their knowledge to manage emerging problems like non-communicable diseases, the multiple needs of the elderly who will outnumber under 5s in the region by 2020, to respond to health emergencies, disease outbreaks and natural disasters. They have to change the way they think and the way they work. Service delivery models are changing. Examples include introducing mid-level health workers in India, family practice teams in Indonesia, primary care networks in Thailand. There is growing evidence of the need to educate health workers to work in multidisciplinary teams, not to be standalone professionals, to meet people's changing needs, to move away from what the Lancet Commission in 2010 called the tribalism of the professions. All this means we need to change the way we train our health workers, be they community health workers, health assistants, pharmacists, nurses, midwives, or doctors. 4 years ago, I made universal health coverage my flagship, with strengthening health workforce as one of the 2 priorities. You cannot achieve universal health coverage without health workers. And in our region, there were major shortages, as well as challenges around quality and relevance. The question was, what to focus on to make faster progress on human resources for health. We decided to focus on transformative education to meet new health needs and on rural retention, where the heart of the problem lies. Countries spearheaded by Thailand committed to a decade of human resources for health strengthening from 2015 to 2024, a realistic time frame to see progress. The clock is ticking. We are almost in 2018, 1/3 of the way through. There was much innovative thinking to build on. The recommendations of the 2010 Lancet Commission on how to transform education to strengthen health systems in an interdependent world provided a solid basis for reform. WHO issued its first guidelines in 2013 on transforming and scaling up health professionals' education and training, aiming to increase the quantity, quality, and relevance of health professionals. It provided policy options based on evidence. There were a total of 11 recommendations covering 5 domains: education and training institutions, accreditation and regulation, financing, monitoring and evaluation, and governance. Today, the big question is, what has changed? Are health workers being taught differently today, with updated curricula and competencies, more emphasis on teamwork and on primary rather than hospital care to meet changing needs? The first review of progress on transformative education as part of the Decade of Human Resources for Health in Southeast Asia region of WHO in 2016 was structured around 11 WHO recommendations. It showed there is much happening, albeit often at early stages of implementation. The 3 most common priorities across this region were curricular development, faculty development, and continuing professional development. Accreditation and regulation of training institutions, both public and private, is also a priority, but with many questions about how to better manage this. To date, there appear to be fewer examples of interprofessional education and team-based training. There was a strong call for better indicators to track progress, along with better data. WHO Southeast Asia region is a fast-changing region where there is much technological innovation. ICT can potentially help advance transformative education in different situations. It can help reach more and different health workers who may be geographically isolated, such as community health workers. It can be used to adapt approaches to teaching and learning. It can be used to improve the administration of training institutions. It can help keep health workers up to date. And of course, no technology is a magic bullet, and countries have their own specific circumstances. I am encouraged to see this topic being put squarely on the table and its potential contributions and limitations being thoroughly debated. I wish this forum all success, and I thank Thailand for opening the forum to other countries in WHO Southeast Asia region to foster the exchange of experience in this area.